Welcome to another edition of Journey of Hope. Stories of people sharing their journey. Life is a journey. Throughout our life, we encounter many different obstacles along the way. They can be bumps, they can cause us to stumble, or they can be building blocks. I really think it's a matter of whether we're looking up or whether we're looking down. As long as we look up, we learn to trust in God. Our special guests today are Bill and Barbara Heisler. Been here in the Loma area for a little over 30 years. And they're going to share the journey that they've been on. You know, cancer is a diagnosis. And sometimes when you hear the word cancer, it really is a frightening experience when you hear it the first time. But it's a diagnosis, not a death sentence. And they're going to share their journey that they've been on. Bill and Barbara, it's good to have you here with us on Journey of Hope.
Thank you.
We've got people from around the world that are watching, but just so they can get acquainted with you, I'm going to start with you, Bill. Where are you from?
Well, I was born in Washington, grew up in Oregon, went to Walla Walla College, graduated from dentistry here at Loma in 1959, and started my dental career in Oregon. Spent some time in the U.S. Army in Germany, then practiced in Northern California, and I've been here at the School of Dentistry for the last 30 years.
For 30 years. I know I saw a 30-year pin. So you're originally from the Northwest. Whereabouts in Washington?
Well, I was born in Seattle, but I never really lived there.
Okay.
I grew up in Salem and on the Oregon coast.
So then you're in Portland area, in the Salem, Oregon area, and then you went to Walla Walla.
Right.
Graduated, and then you came here to dental school.
Correct.
And then spent some time in the Army. Mm-hmm. And from the Army, where did you go?
To Marin County, California, north of San Francisco.
Okay, and had a practice there.
Practiced there for 14 years, kind of raised our children there. And
okay, Barbara, tell us about where you're from.
Well, I'm from Walla Walla, Washington.
Oh.
I was born there, and since it was the Depression, my father had taken the ministry, but they weren't hiring anyone at that time, and so he taught school. He and Mother taught school in little towns like Hillsboro and Grants Pass, and so I lived in lots of places.
Throughout the Oregon Conference, then. Okay.
Then we went to Corvallis, and that was when he was invited into the ministry. That was probably 1945.
In the pastoral ministry, because he'd been in educational ministry. Okay?
That's right.
Then he went into pastoral ministry. Okay?
Yes.
All right.
And at the beginning, he and Mother were the evangelistic team. Mother played the piano, Daddy led the music for different pastors that were the evangelists. So we lived about 3 months in a lot of towns,
Moving
you know.
from throughout the area.
Right.
Now, so what is your maiden name?
Alderson.
Alderson. Okay, and your
Paul
Alderson.
and Margaret.
Okay. Well, I spent
Right.
time in the Oregon Conference as a conference evangelist, so I know moving from place to place. Although we
Yes.
had a home base, but we would move from church to church. So then, where did you go to college?
So then I went back to college. I went away to high school when I went to Columbia Academy.
Okay.
In Battleground, Washington.
That was a boarding academy.
Yes.
Okay.
And then Walla Walla, I graduated in elementary education. And then Bill and I moved down here to Loma Linda.
Okay.
And I taught here for the San Bernardino school
Well,
system.
he was in dental school? Mm-hmm. All right. So now you, in fact, if I remember correctly, you helped getting kindergarten started here in the Redlands area, didn't you?
I did for Redlands Junior Academy, which is Redlands Adventist Academy now.
Today. And they didn't call it kindergarten then.
No.
What was it called?
They didn't. Pre-first.
Pre-first. Okay. Hard to believe that you were instrumental in helping them get started.
That's a pioneer word, I think.
Yeah, pre-first and kindergarten. Okay. Well, that's wonderful. So you've been here in the area for 30 years. Mm-hmm. Made a tremendous impact on both in the educational system and also in the educational system in the School of Dentistry. Bill, what are you doing now?
I'm teaching clinical dentistry part-time. I'm retired from private practice, but I'm still working with these young people, having a wonderful time helping them learn how to make false teeth.
And people are coming in from literally from around the world, aren't they?
Oh, yes.
Participating here in the dental school.
We have wonderful patients, and some that have been patients for virtually as long as since almost when I graduated. I actually have seen patients in our clinic that were being worked on in our clinic when I was a student back in the 50s.
Really?
Yeah.
Can you
That's
believe
unbelievable.
that?
Now, and I heard you saying you're teaching some of the kids in school that she had.
Oh yeah, she starts them out and I finish them
And you're
off.
finishing them up. Oh, what a great, that's teamwork.
Every year I have some students in dentistry that were in her kindergarten class.
Teamwork all of the way.
Yes.
Well, everything's going along fine, and you're both enjoying. How long have you folks been married?
54 years.
54 years.
Yes.
And how many children?
4,
And how many grandchildren?
7.
And are the kids around here?
They live in the Sacramento area and in Reno.
Okay.
But we do have a grandson that's starting medicine.
Wow.
He started in
Another
August.
generation coming along.
Yes.
Oh, that's exciting.
It is exciting, Marcus.
So you've been married for 54 years, and everything's going reasonably well in terms of your health.
Mm-hmm.
Do you have any cancer in your background? Do you have any, Bill?
No.
You don't have any. How about you, Barbara?
No.
Okay, so 20-some years ago, what happened?
I was diagnosed with cancer. My first diagnosis was in September '86, and I had a radical mastectomy and positive lymph nodes. There were 2. And then
That's in 1986?
86.
Okay.
Sometimes I have to look at my...
That's all right. I mean,
just
time
in
goes
case.
by, you know.
I
It's hard to remember
know.
the different dates. So, 1986, when you first learned that you had breast cancer, what kind of an impact did this make on you?
I couldn't believe it.
Yeah.
I mean,
you're
it's
living
total
healthfully and doing everything
surprise.
right?
I thought I was. You know, you just don't know.
Well, how did they find it?
They found it with... You tell them, darling.
Well, she had a mammogram,
Okay.
and that was when the diagnosis was made.
They kind of suspicious, I mean...
Well, there were some symptoms
Okay.
that we'd noticed over the last 6 months before. A lump that could be felt, and some changes, external changes. But I think there's this time of denial.
So,
I
okay,
You
well,
just
here-
don't
this
want
is
to
an
believe it
important
might
point.
be cancer.
I have a special color tie on.
Yeah.
We appreciate
Of breast
that
cancer,
very
right?
much.
I went out and bought that specifically.
And I'm wearing my pink
You got your
bracelet,
pink bracelet.
for that
Okay,
cancer.
so there's a very important point. Self-examination here.
Exactly.
And the mammogram. And then recognizing when you spot something. So when you say a little bit of denial, what are we saying? You didn't like, you ignored what you found?
Right. You think, oh, no, it won't happen to me.
Yeah. And it
I'm
can't really
healthy.
be this.
And I was about 50 years old, and I was just at my prime.
Sure. Oh, yeah.
How about that, if
so
there ever is a
did
prime?
It, did it take a little while before you went in then to have follow-up or to really pinpoint what was going on?
Well,
No, my husband made me go. He said, because he had attended something about cancer, and he said, when he came back from that seminar, he said, Barbara, this is serious. As soon as we get home, you're going to have to see the doctor because I don't think it's good.
So this provided you an opportunity to kind of nail it down and say,
Exactly.
hey, we need to go in and find out about this. And when I say we, I do mean that because when you have cancer, it's a family. I mean,
It is.
The whole family is involved. So Bill's saying, hey, you know, I just came back. I think you need to go in. So you go in. And what did you find out?
So that's when they found out that I had cancer.
Okay. So did they just...
They did a biopsy.
They did the biopsy.
And they found 2 lymph nodes that were bad.
Okay. So, I mean, just 2 little lymph nodes. So why did you end up with a radical mastectomy?
well, actually, they did the lymph nodes at the time of, they did a biopsy at the time of surgery, verified the lesion, and then Bo-Ying Watt, who was one of my teachers in dental school, called me while they were in surgery and told me they'd verified it.
So that it was in the lymph nodes.
They went ahead and did the mastectomy and did
At the same
a
time,
radical. which
Right.
includes
Yeah.
lymph nodes, and there were 2 positive nodes.
So they just wanted to be safe and make sure that they got it all. So they did. So how long were you in the hospital? Do you remember?
About 4 or 5 days.
Only 4 or 5 days.
Right.
And then you come out, and what kind of a regimen did they have you on? I mean, did it finish? Did you have to have any follow-up? Did you have to have any chemo or anything like that?
So that's when they said, you said something about those 11.
Well, they took out 11 nodes, 2 were positive, and they said anytime there's positive nodes, we recommend a series of chemotherapy.
Because
so
it's out, we want to make sure.
Yeah, so
That's right.
she had her surgery, I think, in October of '86, and we started the chemotherapy probably in November. It was a series of 8 treatments, 3 weeks apart, and we met every one of those right on schedule.
So you're talking about 8 treatments?
Over 6 months.
Every 3 weeks you're having a treatment.
Right.
So did you get sick from that?
Very sick.
Okay, and we're talking
I
about
really
20
did.
years ago, so
Exactly.
this is, this a little different today.
A whole lot
in,
different.
in
Yes.
many ways. But so you had 3 weeks. So you have a treatment, and then are you sick the following week?
Well, I'd have my treatment on Thursday because I was still teaching.
Oh, you're
And
teaching this
so-
whole time.
Right. I needed to be with those kids, though.
Sure.
They were part of my life and my support group. So I had a lady that was my assistant, and she would take Friday for me, and then Monday. So I had Friday, Sabbath, Sunday, Monday
To recuperate.
to recuperate. And at first, it wasn't, it was bad, but then as you go along, you get the accumulative effect.
So yeah, by the time you go back to school on Tuesday, you've kind of recovered. But 2 or 3 or treatments into it, it's lasting longer and longer.
I know.
Did you find? Were you able to teach all the way through, or did it get to the point where you had to take off time?
I did have to take off a little bit more time toward the end.
Now, what are you thinking all this time? I mean, I know that you've both been active in the church. You both prayed about it. You find out you have cancer. How do you relate to this? Where's God in all this?
I know.
What do you say?
You have to stop and think about those questions.
You sure do.
Everyone has those questions, I think, no matter what. It's the humanness of it. But, the Lord has a way of saying, I'll be with you throughout all of this. And so we just hope for healing, of course. But
You hope and pray for healing. And
for healing.
Trust that the Lord is going to
Exactly.
hear an answer. Sure. Okay.
And we find out as we go along that we know we might not be healed, but that the Lord will always be with us, no matter what. And that's the one good thing about cancer is that you realize
I want to hear one good thing about cancer. Okay.
is that you realize your mortality, and you realize that life is very fragile, but and that we all have just one day at a time. Like I have one day at a time now, like I did when I had cancer.
One day.
One day at a time.
So, in
Just
other words,
like
when you
everyone
meet
here.
somebody else and they say, "Oh, I'm sorry you've got cancer," what do you say?
I say thank you very much, because I appreciate your concern, and it's nice to have a support group with this.
But I have one day, and you have one day. It's today.
Yes,
That's why
it's
the psalmist
today.
says, "Today is the day of the Lord. Let us
It is.
be glad and rejoice in it." So,
Oh,
so you're
yes.
going through this. You're going through the chemo, and undoubtedly the church is supporting here at this time.
Yes, they
School
are.
of Dentistry is involved, I'm sure. How's this
Yes.
making an impact on you, Bill?
When she first got the diagnosis, I was self-accusing because I thought I've killed my wife because I didn't insist when I
Early
first
on.
saw the signs that we get a diagnosis. And
Blaming yourself.
there was some, not a whole lot, but some self-blame. We never doubted God. We
No.
never, I don't think it ever entered our minds to doubt God because, we've been raised in the Christian faith and to believe the stories we've heard and God's providence
Sure.
and whatever His will is, I tend to be very pragmatic.
But you were thinking, if I would have made a decision here, we could have got this earlier. Maybe this whole thing could have been avoided, or at least wouldn't have been as bad as it was.
Maybe wouldn't have had to have the
Sure.
chemotherapy, which was by far the worst part of the whole thing.
Sure.
And then, you know, the physical changes, that's not a real pleasant thing either.
Sure.
But we've lived through it.
So you made it through that, and the church, the people you're working with, supportive, the kids, I suppose the families of the kids in
Yes.
school, they're all lifting you up in prayer, and so,
I know.
and things are, you know, I mean, it's drawing people together. And you're right, when you get diagnosed with cancer, all of a sudden you hear that clock of mortality ticking
I know.
louder than ever before. It's always been ticking, but you're aware of it. You know, there's
Right.
a time frame on my space here on Earth. You know, everybody talks about being anxious to go to heaven, but nobody wants to leave the day. You know, nobody wants to leave the day. So people are praying for you. You get through this period of time and recover. So you finished chemo. Did you go through reconstruction after that?
Yes, I
so
did.
there's I mean, we're talking about a long period of time here then. A couple of years,
Right.
really, aren't we?
Yeah.
Yeah.
In fact, I went ahead and had a double mastectomy at that time because I didn't want to have to go through this all over again.
So now, when you say,
Prophylactically.
did you do the double mastectomy to begin with?
Well, just
No.
No, it came later.
it
Year and a
came
half
just
later.
before my reconstruction.
But you wanted to do it prophylactically, saying, man, I'm not going to take a chance. Let's take care of this all at the same time.
Right.
So you did it. And how long after the first surgery did you have the second one? I mean, is it about a year or so?
Year and a half.
Year and a half.
Year and a half.
So you've kind of recovered from the chemo. You had the surgery, then you have the chemo. Finally, your body's getting built back up again. So you go through a second surgery. Now, you didn't have any chemo following that one.
No.
So then you go through the reconstruction. So then everything's going pretty well.
Yes,
For how long?
for 21 years.
I want our listening audience to hear that.
21 years.
Everything is going well for 21 years. No other major health issues. Nothing for you.
Well, I had about prostate cancer along the way.
Just a little bout. Okay.
I'm
okay.
doing fine.
All right.
He had the proton beam.
So he had the proton beam. So it took care of that. Just a little bump in the road. All right. So everything's going along well for 20 years, 21 years. And then what happens?
Yes, then what happens? Well, I noticed my left arm was getting very swollen. And in fact, it was really alarming. It was so huge. And so I went to my primary and said, what's going on here? And she said, your lymph system is not working. And so she sent me to physical therapy, and they were able to show me how to do the exercises.
How to treat it and reduce the
and how
swelling.
to treat it, right.
Okay.
And I appreciate that very much. But then I started getting bad pains in my belly and my back. And
No
so
relationship to the arm at this point, as far as you know.
No.
But you're able to control the swelling. Now, this is on the left side. Where was your original tumor? On what side?
Left side.
Left.
It was
side.
on the left side, so same side. But nobody's made the analysis yet, or the comparison,
No.
or the okay. So what happened then?
So then
It's these pains in a couple of different areas.
So she said, we've got to run this down. She said, how long has it been since you had a mammogram? And I said, oh, at least 20 years, because I don't have anything to take a mammogram of.
Had a double mastectomy. Why would
Right.
you need a mammogram?
Why would I be having any
Sure.
problems? Everything was
Good
gone.
question.
And she said, that's a good question. I'm going to send you over here to the FMO and have them run some tests for you. So they did, and the PET scan and the CAT scan, they came up with metastasis to my lungs and my ribs and my spine. And then there was a tumor behind my sternum.
So we're talking
On the left
about
side.
several areas, a metastasis. They didn't do a mammogram.
No.
No. Okay, but they did some other testing, and through the PET scan and these other tests, they discovered it's where now?
In my lungs
Lungs,
and ribs
ribs,
and spine,
and spine.
as well as this large tumor.
And are they saying it's the same cancer, it's just metastasized?
Yes, because I asked that, is this a new thing? And they said, you know, probably not. And then with different tests later, they said no. It was
Wow.
just a reoccurrence.
So how did this impact you?
Oh, I was devastated because I told my husband, you remember I said I was never going to do chemotherapy again. In fact, it just kind of does funny things to you. For while I was in treatment, every time I would come down Barton Road to go to the FMO, Bill would bring me every time, and I'd get to the parking lot, and my body would just say, why are you doing this to me? Don't you know that you're killing me? I can't stand this. And as it got worse and worse, at the last two, Bill would just have to pray with me that I could go through with that.
So it was just a
'Cause it
horrible,
was
horrible
just-
experience.
But
And so
see, this was a long time ago, and they had what they called the cocktail.
where it's a combination.
Yes, of quite a few things. And so they said, you know, we can put you in a study that will be because your tumor is estrogen receptive, we'll give you these blockers. They seem to be working pretty good. And I thought, well, I guess I could do that, of course. So I was praising the Lord that I could do that. And it worked for 2 years.
So even though you had this, you're able to praise the Lord because you look like you're a candidate for this special test that's going on. And so it worked for 2 years. Now, when you say it worked for 2 years, did the tumor start to shrink and start to disappear? Okay? So you have 2 years, you're praising the Lord.
And my lungs, you know, all of that, it was going dormant.
And so everything is looking up and you're praising the Lord.
Exactly.
And then what happens?
So then I get this pain, a bad pain again, this time right in my neck and everything in this area. And so the doctor said, that doesn't sound so good. I don't like that. And sent me to get a PET scan and CAT scans. And they found another tumor. Right?
So this thing just doesn't go away. It just kind of keeps coming back and keeps coming back and keeps coming back. But you're a fighter. You're a fighter. And
I don't know if I am or not, but I have a lot of people around me that are.
Well, you're a fighter. I can tell you're a fighter. And not only are you a fighter, but you praise the Lord no matter at every step of the way. So tell us what's happening now, because this is the last several months. And are you under some kind of treatment now?
Well, so then I had to go into chemotherapy, but the doctor told me, I said, I just don't know if I can do that. And he said, it's just one drug, and you shouldn't have the symptoms like we had 24 years ago. So my husband said, let's talk about this, and our family.
Oh, sure.
And the kids and
everybody's encouraging you to go ahead.
Yes.
It'll be different this time.
And it was.
Wonderful.
And it was. You know, we have the new cancer center, and that I can't say enough about that, because when I first went for my first treatment, it was up here at the FMO, and they were so crowded in with a whole bunch of things. Now they have the big cancer center and all of these treatment places. It's wonderful, and the people are so supportive. You just feel like you're going to see family every time you go.
Well, and that's a very important part of this whole cancer process,
Isn't it?
Having the support of the family, of the loved ones, of the church, and now you're talking about the support of the cancer center. So
I know.
You've been involved in treatments. How is it going now?
So I'm in remission now.
Praise
as
the
of
Lord.
April 1, or April. We had final tests, and they said, I'm in remission, and I'm on tamoxifen now.
Okay. Which is
And
should be helping
so
out.
it's supposed to hold it. We'll wait and see, you know, what that does. But for now, it's good. And the one thing I do want to say is that even if I hadn't been healed, the Lord was in my life through all my church members that were praying and my friends and my loved ones. And I knew that I was in a good place, and it was just up to the Lord in this journey of mine. Whenever He says that's as far as we're going to go now, that's as far as we're going to
So
go.
your trust is in Him, and you know this is a
Yes.
journey you're both on together, hanging
Absolutely.
on, and
I
you
know.
got one day, just like I've got one day, and
Yes.
he's got one day. And all the
That's
people you
right.
meet, they have one day. Well, you know,
Right.
Barbara, it's a thrill to listen to how God has been guiding and directing you. And you know, there's been some ups and downs. You think things are going fine, and for a while they are. God's hearing your prayers. He's hearing the prayers of
Yes.
others. And I don't know why He doesn't heal instantly, but I know that God always hears prayers. He always answers them in the right way at the right time.
That's
And again,
right.
for our listening audience, Bill and Barbara are a marvelous testimony of a couple that have been on this journey, struggling and rejoicing and praising the Lord as they've gone through this cancer together. We don't know what the future holds, but we know who holds the future.
That's right.
For our listening audience, just this week, I know that some of you have received some sobering news. You don't know which way to turn. You don't know what's going to happen. But I can tell you that God, He's got a plan for you and for your life and for your family. If you look to Him, He will open and close doors that you'll be able to discern His will. And like Barbara and Bill, they have the confidence that God's guiding and directing and leading them step by step.
Right.
All of us have one day. It's today. Now is the day of the Lord. Today is the day of the Lord. Let's be glad and rejoice in it. Give God an opportunity with your life. He's waiting for you just now. Thank you so much for joining us. Until next week, I'm Lynn Martell with Journey of Hope. Thank you. See you next week.
Thank you.